Stone. I'm the creator and editor-in-chief of Local Vibe magazine, and Local Vibe is a digital magazine all about local business, events, and culture. So I am joined here with my sister Dani. She's a nurse practitioner, and I'll let her introduce herself.
My name is Dani Stone, nurse practitioner. I currently work at a full-time as a primary care physician or provider, and also went in business with my daughters to do a med spa for beauty, wellness. We do Botox, toxin injections, and IV vitamin infusions, IV like B12 shots, fat burner shots, those types of things. And so just trying to help people feel better inside and out.
Perfect. So in this next issue of Local Vibe, we're going to start doing a permanent article called Vital Vibes, where anyone can ask Dani questions, medical questions, or we're just going to wing it and go from there.
Okay.
So today we're going to talk about stress and the effects it has on your mind and body, and the importance of de-stressing and ways to distress. Okay. How do you define stress from the medical and physiological perspective?
How our body reacts to external environments, such as, we're going through a tornado, or something bad's happened, or some bad things at work or with kids or whatever. We get overloaded, overwhelmed. So that's generally the medical part of it. How it affects our body is it can increase our heart rate, it can increase our blood pressure, it can increase our respirations. Therefore, we have a lot of, if you have issues with those problems, heart rhythm problems, that can affect that. Blood pressure issues, that can affect that. Can affect your sleep, which in turn affects all those other things. So they're all connected, and stress can have in our moods too. In anxiety, depression, it all encompasses each other.
What are the most common signs that someone is experiencing chronic stress?
There again, blood pressure. Those that have blood pressure issues, if you're having a lot of stress, then blood pressure, you can have blood pressure issues, may have to have more medications to control that. See a lot in the clinic, people will come in, we joke around a lot in the clinic with people about they're just happy to see us because their blood pressure is high. Some people have the white coat syndrome or whatever, so their home readings might be better. But I've noticed that with increased stress, anxiety, their blood pressure can be elevated, and you've got to keep that down so that their heart stays strong over their lifespan, so they don't have a lot of other issues with their heart. It affects your heart rate that same way. So if someone has a rhythm problem, such as like AFib or SVTs, which is fast heart rates chronically, that can make it even more, therefore again needing more medications. That also can affect respirations. People that are asthmatic, already having trouble with breathing problems, during allergy seasons or whatever, then they might have to use their inhalers more often, which those also have side effects, and that can make stuff. So just stress overall in general can lead to those things, as well as sleep issues.
Here, but besides medications, what are good ways to help with stress levels?
Well, most commonly is just your general deep breaths, calm environment, trying to get out of whatever situation you're in if you can, but deep breathing, relaxation, any kind of relaxation techniques, just to calm your heart rate down, calm down your breathing, those things, so you don't have
a severe asthmatic episode or an increased heart rate episode, just, you know, those kind of things. It's mostly, generally, it's that, just trying to get into that calm your mind down environment.
I'm really bad about, like, in between questions, talking. Can stress, and we probably already talked about some of this, but can stress affect people differently based on their age, gender, or lifestyle?
Gender, I don't see how gender could play a huge role in it. Lifestyle, yes, probably. Just how you react to everything. You know, appetite plays a big role in everything, so that's a lifestyle problem, issue. Age, I'm guessing, yeah, that's really kind of it's, you know, it's going to affect children different than adults, of course, because a lot of kids don't know how to de-stress. You know, they don't. If they're in a traumatic situation, it's hard for them to learn how to deep breathe and calm down and things like that. You know, then age-wise, the older adult, of course, may already have some chronic heart issues and stuff. So it could affect just different things that way. But that would be my overall take on that.
Okay. How does stress impact the brain, and can long-term stress lead to permanent changes?
Well, brain, how it really affects the brain, I think, is more related to sleep, because you really need a good, solid sleep routine to keep your cognition, your brain functioning properly and things like that. So that's the biggest part. Then, of course, if you're not on medications, then, you know, those two can affect your thought processes and stuff. But long-term effects, I mean, if your blood pressure is high and elevated and your heart rate goes up, things like that, you're decreasing, sometimes decreasing blood flow to the brain. It can, you know, so that can be some things. And if your heart rate or your blood pressure gets high enough for long periods of time, you can develop strokes. So there again, that can affect your brain over a lifetime. And, you know, how open or narrowed your blood vessels are in your brain. So it can affect it that way.
Well, how can it affect the immune system, and can it make people more susceptible to illnesses?
It can affect immune system by decreasing the immune. It decreases the immune system by, in turn, increasing inflammation.
And what are some ways that chronic stress contributes to heart disease and other cardiovascular issues?
Talked about the strokes, how it can affect your. So if you have AFib, a chronic heart arrhythmia, you can have blockages, your blood clots in the heart. Therefore, if your heart rate goes up, you're gonna not pump blood around good enough, so that can cause some issues with blood clots, which can affect your brain and your heart and your lungs, anywhere in your body. There again, if our blood pressure goes up for a long period of time due to stress, then, you know, you can have either one of those two can develop a stroke. So those are the biggest things that I can see how it affects your cardiovascular system.
What about the digestion and metabolism? What ways can it affect that?
It can increase nausea. People can get nauseated really. That can make changes in your appetite, not wanting to eat well. There again, people can stress eat, so then you gain weight. You may have increased reflux, acid reflux, from just increased stomach acid due to stress. See that quite a bit. Then that can turn into ulcers. Ulcers can turn into cancer. So a lot of different things in the gut, and then of course it can affect, you know, most people that I come in contact with have problems with chronic diarrhea because it just increases the gut rate, so you're not getting, and then when you have that, you have a potential for, you know, electrolyte imbalance, other issues with the gut too that way. So
There's some quick science-backed techniques to reduce stress in the moment, or are there any?
I'm sure there are, but I couldn't tell you. Moment, I guess, really would just try to be that deep breathing, calming your mind down, slowing your heart rate down. In the moment, that would be probably the best. I'm sure there are other techniques, but that's probably going to be more of a mental health issue.
How does physical activity help relieve stress, and is there an ideal type of exercise?
Physical activity can do a lot of good things for your body. Of course, we all know, everybody talks about, you know, weight loss and all that fun stuff, but what you don't think about with physical activity is how it boosts your immune system by the good hormones, your endorphins and things like that help, and then in turn that makes your heart rate better, stronger, your blood pressure goes down, you sleep a lot better, your mind is better. You know, there's just a lot of different things that it affects well. How types of exercises, I mean really anything that you're comfortable doing that's safe for you, as far as, you know, joint health. If you have bad knees, of course you're not going to be a runner. You know, walking is always good. It's always good for everybody and their muscles. It just gets blood pumping and oxygen to all the parts of the body. Yoga is a good de-stressor because it helps. That stretching exercises and the calm breathing and things like that has always been probably the best go-to, I would think, for stress.
What role does nutrition play in managing stress, and are there specific foods that help?
Of course, we talked about how stress affects the gut. So therefore foods are going to affect it. So if you're not eating well, then, you know, that's going to be poor nutrition and you're not going to feel good overall. But foods high in fiber are probably the best thing just to keep things moving appropriately. So, you know, things high in fiber can be like oatmeal, good grains, healthy grains, fruits, crunchy fruits, apples, pears, those kinds of things. Vegetables, the crunchy green vegetables, cucumbers, squash, asparagus, broccoli, all those good fibrous crunchy vegetables are always good for that. The best thing about diet, and the thing that I see that is the worst on our diet, is processed foods. Our diet's horrible, and that affects everything in our body, and it's going to affect stress. Going to make it, you know, make you worry, or not worry, but make you feel bad. You know, if you're doing really good and you go out and just binge for the weekend while you're on vacation or whatever, I don't know how many people I've talked to, just they feel horrible when they come back because they've just ate junk and not done their normal exercises. Yeah, they kind of maybe made their mind a little clearer because they've gotten away from work and all that fun stuff, but then again they have to come back home and get started all over again.
Life is still there.
Exactly. So try to be good when you're out.
Can vitamin infusions, B12 shots, or other treatments help with stress relief?
Yes, they can, and that's what I like to do. So vitamins, the biggest vitamins for stress are your B vitamins, your B complex, your B2, B1, B6, B12. So vitamin complex. Of course, magnesium is good for your muscles, just like potassium is good for your muscles, you know. But magnesium is good for your brain and your muscles.
Now, is there a specific magnesium to take? Because I know there's
you can do over-the-counter magnesium, or there are prescription strength magnesiums as well. But as far as like vitamins and things that we do in the spa, is just an infusion of a certain milligram of magnesium, a B complex dose. Then you have your vitamin C, which is always good for your immune system. There again, that all works together. Those are the biggest ones. Of course, there's always more antioxidant type vitamins that are good. Glutathione is one that's really good for the immune system. So, you know, if you can get one, usually if you can get one area of your body better on track, then a lot of them will follow. It's more of a little cascade effect. One's off, the other one's off, the other one's off. So, just a big thing.
How important is social connection to combating stress, and what happens when people isolate themselves? Because I like to isolate myself.
Yeah, so, you know, I learned, as a mom and as a patient myself, when I was going through breast cancer and all the treatments there, that stress level itself, you know, you get down on yourself, you don't want to do the things, or you're afraid to do things, or you know, your stress is too high when you're out in public events or whatever, the anxiety part of it. You know, depression has a lot to do with your, you know, just how you feel overall. People, there again, we go back to our nutrition. When we're stressed, we eat bad, and when we eat bad, we don't feel good, and then we don't feel good, we don't want to go anywhere, we don't sleep good, we don't want to have the energy, we don't have the energy to put forth in getting ready or driving to any events, or even, you know, we just don't feel good about ourselves, so therefore we don't want to be around other people. So, but what I was saying was, what I learned when I went through counseling, and I know this isn't about counseling, but I just learned how to find happy things to do, things that made me happy, things that, like when we would do our sister dinner, or we'd just once a month, we just all of us get together and have dinner. That to me made me happy.
Well, let's start it up
I
again.
know, right?
I mean, Stephanie can come up from Florida.
Well, exactly. You know,
or we can go there.
Yeah, exactly. But you know, those kinds of things, and that's what my counselor had said was, you know, if it's just once a month, do something that you like to do. Find a hobby that you want to do. So now my de-stressor is I'm doing quilting. My other de-stressor is I like to get out in the garden, play in the dirt.
And I'm so excited for garden season.
Digging in the dirt, planting new things, seeing things grow. Everybody has something, or should have something, that they like to go to. So if they are at home, they are not just sitting around doing nothing, watching TV or, you know, whatever. I mean,
and that just makes you feel crappy in itself.
Yeah. I mean, you know, sometimes you want to sit around and just binge something on Netflix or whatever, but that shouldn't be an everyday event. And then, you know, if you have like the grandbabies, you know, I try to, when we were growing up, we went to Grandma's every Sunday. If you remember, Grandma Martin's, we were down there just about every weekend with Carly and all the cousins.
I do remember going.
We would go every Sunday. We would go, or at least every weekend. And after church on Sundays, we'd always go to Granny's and Poppy's and eat lunch every Sunday. So I have, with my girls, we're trying to do that now. We're trying to do every Sunday after church, which of course we didn't do it today.
Not my fault.
No, we didn't do it last weekend either. One of them was out of town on vacation, Sophie. But you know, it's just fun to have dinner, you know, and get together. And it's just a few people, but it's the grandkids. They love to play together, and that's something that we all like to do. So finding something that you like to do is going to help you get out and do more things. Does that make sense? Yeah. So that's just what I learned. That was the one big take that I learned out of my counseling sessions, was finding my happy times, and whether that was by myself or with somebody else. You know, you can be alone but still do something productive or happy.
Yeah,
that makes your mind healthy.
Are there any big misconceptions that people have about stress?
Misconceptions. I think, well, I mean, everybody that I talk to in the clinic, when they're stressed out, their misconceptions are, I'm gonna have to be on medications. You know, their fear is having to be on medications for the rest of their life. People don't take medications now. They don't want to have to be on a medication to, you know, get their stress, depression, anxiety down or whatever. And it's that simple. Sometimes if you do those things, if you eat right, if you sleep good, if you take care of yourself even a little bit, you're probably not going to have to be on medications. Now, I do think, and I try to get my patients to go to counseling, to see a counselor just for a bit, just to help you learn a coping skill for how do you de-stress, how do you, just because I didn't know before I went, and so I learned a lot from that. So I try to get patients or people to think about themselves versus, oh gosh, I'm gonna have to go on medications all the time. I think that's the biggest misconception.
How can busy professionals and entrepreneurs like yourself prevent burnout?
Well, I have that problem a lot from my full-time job. It's just back to that, finding the things that you like to do and doing them.
Right.
Whether you have 12,000 charts to close by a certain deadline, just saying, do so much of it today and then do something you like to do too, or that's the big, and working out. I think the biggest thing is exercise. That always makes you feel better, sleep better, get good sleep.
Yeah.
So that's how you can take care of yourself when it's because sometimes you can't control the situation, but you can always control your lifestyle.
It's feeling completely overwhelmed. What is the first step they should take toward managing their stress? And I think we covered that too.
Yeah, but if they're just feeling that overwhelmed, how are they, what's their thoughts? Do they need to call 911? Do they need to call that, I don't even know what number it is now.
Is it
388 or something? There's a 3-digit number and I need to know that.
Yeah, Dani.
I know, I'm sorry. But there is a 3-digit number that you can contact for which is kind of like a hotline for those people that are really severely depressed, severely stressed, severely anxious. That would be the biggest, or reach out, talk to somebody. If it's your sister, if it's your daughter, if it's somebody that you can just call to get your mind off of whatever's going on, or if it's a bad situation that you're in, there's got to be somebody that you can contact, to talk to reach out to. That's the biggest thing, other than making your own little lifestyle changes.